How can that be? Well, one reason is that if you have an artery that's totally plugged, then in some way along the way, collateral circulation developed. So there were side channels that brought blood to the tissue. And those channels were working pretty well, so it didn't really help to open that main highway of artery because the side channels were working well. At least that's the theory. Okay, most of the improvement that we get in cardiovascular disease, and there has been some improvement in the last 30, 40 years. It isn't great. There's still the #1 cause of death. Heart disease and stroke is #3. However, there has been some improvement. But if you really look at the cause of that improvement in an objective basis, most of that improvement is due to improvement in lifestyle factors. Not so much in the cardiovascular surgery or the drugs, especially when you're looking at the death rate. So we must do a better job with these lifestyle factors, the traditional factors, as well as looking at new factors. And we can do considerably better when we look at integrative medicine. Lifestyle factors with integrative medicine include the same ones that we were talking about before to start out with. And that is diet, healthy diet, obesity, moderate exercise, no smoking, and then we get into stress control. Now, most conventional doctors acknowledge that stress is a factor, but they don't do much about it. Maybe give tranquilizers or antidepressants, but they really don't do much about it. One of the strengths of integrative medicine is that they do something about it. And then there's a category which I call interaction with the environment. And that includes toxicity, huge factor, toxicity, sensitivities or allergies, and various imbalances that can occur in the body as a result of this interaction with the environment. Let's look at diet and obesity. The Mediterranean diet, the LEARN diet, or the DASH diet is for hypertension. These are conventional diets that have circulated in one form or another in the cardiology community. And there's a vegetarian diet and the Ornish diet. Ornish diet is virtually a vegetarian diet, very low in fat. And the vegetarian and Ornish diet are ones that have showed that you can reduce plaque a little bit just with the diet alone. So those are they're helpful. However, they didn't show that they could improve the death rate. They weren't any better than surgery was that way. They were helpful, but they weren't better. Now, just in the Journal of American Medical Association, 2007, February, one of the February issues, they tried to show that the Atkins diet, or the low carbohydrate diet, was not nearly as good as the other diets. However, much to their surprise, the Atkins diet showed that people who used that diet lost twice as much weight as the other diets, as any of the other diets. And they also had a much better reduction in cholesterol and a raise in HDL and lowering in high blood pressure, especially in women, but in men or women. So head-to-head with these diets, the lower carbohydrate diet came out ahead. Now, we recommend a version of the lower carbohydrate diet to most of our patients. Not all of them. We individualize it. But we don't go hog wild because the Atkins diet says virtually about any kind of fat is okay to eat. And we still think it's a good idea not to eat the real bad fats. Another type of diet, particularly in people that have trouble losing weight, is an alkaline diet, or you go over to an allergic diet. And that's when you test with a blood test to see how many foods you might have antibodies against. And you eliminate those foods. And a lot of times those foods are the ones that make it very difficult to lose weight. The foods you're allergic to tend to hold weight on. They hold fluid and weight on you. If you put all the diets together that have been healthy, they have certain things in common, pretty much. One is they emphasize fresh fruit and vegetables, particularly vegetables. And 5 to 7 servings of fresh fruit and vegetables today is ideal. Avoid harmful fats. Avoid processed foods and trans fatty acids. A lot of processed foods have trans fatty acids in them. And you avoid sugar, excessive sugar anyway. Avoid excessive alcohol. Now, some alcohol might be healthy, as we mentioned earlier. Maintenance is the most important part of any diet. It doesn't matter if you lose 50 pounds. If you don't have maintenance, then you're going to gain it all back. So from the beginning, you need to look at what you can sustain in the way of diet and not just lose the weight. Because you don't want the yo-yo diet where it keeps going up and down. Supplements are oftentimes recommended and can be helpful, and they're used often by integrative physicians. Exercise. Pretty much the consensus is that you need about 150 minutes of exercise, aerobic exercise a week. Now this is walking, biking, swimming, moving your body. So it raises your heart rate up a little. If you get your heart rate up above 100, generally you're doing well with exercise. Now if you're on a beta blocking drug, it might be pretty hard to do that because that slows the heart rate down. But most people can raise it up to 100. Stretching is good. It helps prevent arthritis and unstable joints. Weightlifting can be helpful, particularly to prevent osteoporosis. But you don't want to do real heavy weights, just moderate weights. Now the exercise helps you feel and function better. It improves the quality of life. But it does some effect on longevity, but it doesn't have a real big effect on longevity. One thing you need to be careful about is overdoing it, the weekend athlete type thing, and not listening to common sense, and you get injuries. You can stretch ligaments and create unstable joints. If that has happened to you in the past, or if you've had an injury or an accident that messed up a joint that you're having trouble with now, a lot of times we can strengthen the ligaments around the joint with a process called prolotherapy. And those are injections that actually strengthen those ligaments, a very useful treatment. And a lot of times that gives permanent relief for arthritis and unstable joints, or low back pain, or neck pain, or shoulder pain. Another therapy that you may have seen around advertised, a number of the chiropractors have it in the area, is called decompression therapy. Now that's for the low back particularly, but it's a form of traction and vibration that rehydrates the disc. So that if there's a disc problem, either a ruptured